You are muted. Finally,
You can't hear me? Hold 1 2 1
I
2.
can I can hear you now.
You can hear me now. Okay.
That was great.
That's perfect, right? And just so you know, I can see that there are people logging in and taking a look to see what's happening already. So we're good to go. We are live with Brainstorm from Dr. Symeon Missios. I'm Ryan O'Neill Williams. I am live, coming to you live from
From
Jamaica, and
oh,
my good friend and our great doctor is here, coming to you live from Long Island himself.
not
How
nearly
are
as
you doing, Doc?
exciting.
Hmm?
Not nearly as exciting.
Not nearly as exciting. Well, we can't all live the nomad lifestyle. It's a situation that is evolving, right? It's happening.
Ryan has just walked in from the beach.
Absolutely not.
Probably still has sand on his
In
feet.
between my toes, right? No, we're doing a bunch of business, but then on top of that, yes, we're meeting with family, making sure they're okay. It's an interesting thing to actually do this. Hold on 1 sec. To actually do this from Jamaica, where we're going to be talking about stroke today, and I have to tell you that is one of the major things that disabled people here. I'm assuming it might have something to do with the pressure that happens in the brain, because that's basically what I saw was the main reason. They said basically that stroke is it occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts or ruptures. Is that correct, Doc? Does that make sense?
Yeah, so so May is Stroke Awareness Month.
Uh-huh.
So there are a lot of efforts put in by major organizations so that people can be made aware of what a stroke is
Okay.
and what the symptoms are.
Yes.
Because stroke is one of the diseases where if you catch it early, you can make a difference, to put it bluntly.
Okay.
And a stroke is a disease of the blood vessels of the brain. And
Yes.
when we talk about the blood vessels, we mean the arteries, which are the blood vessels that take blood to the brain
Yes.
from the heart.
Yes.
And you can have two different types of stroke. You can have a type of stroke that we call ischemic stroke. And what that means is that one of the blood vessels becomes blocked. So there's an area of the brain that doesn't get enough blood. And there's a
Okay.
type of stroke that we call a hemorrhagic stroke, which is when one of the blood vessels becomes bursts or leaks blood outside the blood vessel.
Okay.
So
Yeah.
we're gonna talk about the first type of stroke here,
Ischemic.
the
Okay.
ischemic stroke, the
Okay.
stroke that involves a lack of blood flow. And
Okay.
that's what most people, when they refer to stroke, that's typically what they mean.
What they know about. Right. Okay. Very well.
So what did you notice in Jamaica that you said there's a lot of uh,
Oh man.
patients there with a lot of people
I
with stroke?
I grew up uh, close by a man who was a very active. He ran a shop. He ran a shop in the town, and one day he just went away, and we were like, "Well, what happened? Whatever." And he came back, and yeah, he had had a stroke, and
Yeah.
it was many years. His wife took over for him, was many, 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 many years before I even saw him walk again. And so I know that it happens pretty often. But in general, I know that when you see people are disabled here, a lot of them it's because that you'll say that's because they had stroke. You'll hear
Yeah.
that. Oh, they had stroke, and they have one or two. Sometimes they have multiples. It sounds as if it's something that is difficult to get rid of. Is that the case?
Yeah, and it is very prevalent.
Yeah.
In the US, stroke is one of the top three leading causes of death, and
Hmm.
certainly one of the leading causes of disability.
Yeah.
And it happens very suddenly,
Yes.
and oftentimes there is very little warning.
Speaking of which, I have a question from a listener, and that's literally what he's asking. What are the warning signs of a stroke?
So the warning signs of a stroke are um, they depend on what blood vessel is occluded, but they can involve signs like weakness, and that can be weakness in an arm or a leg, or weakness of the face, leading to a droop on the left or the right side of the face.
I've seen
Uh,
that.
yep. It can involve difficulties with speaking. Someone can become completely mute if they have a stroke, or they can have a hard time forming the words. It can someone can be very dizzy, or very sleepy to the point, where people are having a hard time to wake them up. Any of those things can be a sign of a stroke. There is an acronym that's called FAST that the American Heart Association came up with, and it's just a quick way to think about the symptoms so that the public can be made aware of them. And F is for face, for facial droop.
Okay.
A is for arm or leg weakness. S is for speech, and T is time to call 911. So,
Mm.
when any of those things happen, someone needs to go to the hospital immediately. And
Okay.
and the you can't stress enough the importance of getting someone to the hospital right away,
Okay. Right. Right.
because
Right.
that can make a huge, because you're talking about an area of the brain that is not getting enough blood, and if you can intervene quickly enough before that area of the brain dies, if you can intervene and restore blood flow, then you can minimize the symptoms.
Okay. Okay. All right. Cool. One of the other questions I have here is why is stroke called the silent killer? Liz was asking that. I mean, is it because some of the symptoms are more difficult to see?
I think that the main reason why it's called the silent killer is because it happens very quickly. It can happen in the middle of the night where people don't even realize it, and it may not get picked up until the next morning. Or if someone lives alone, they may have a stroke and nobody will know until someone checks up on them. Uh, Stroke sometimes involves very small blood vessels in the brain,
That would make sense, right?
and if it's a very small blood vessel that is occluded, it may not cause any symptoms at all. And I
Hmm.
think that's where the silent comes from. So someone can have a number of very small strokes and not know about it, but eventually the damage builds up in the brain, and eventually it leads to symptoms. So
Okay.
being aware of that is very important, because trying to modify the risk factors that we can modify is really important, and it can help prevent this from taking place.
Okay. All right. All right. So let's. Do you have any uh, diagrams for us? Because I love those diagrams that
Yeah,
you have.
no,
Do you have any today?
I think it's very important to talk about the risk factors here.
Oh, okay. 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 Let's get into that as well.
That
Okay.
would
Very
be, yeah, that's what I was alluding to. That would be, I was trying to set up the question for you.
well. Well done, sir. All right. Very well. All right. So you have some stuff for me.
But the risk factors that for a stroke, the first and foremost is, so there are some risk factors that we can change and some that we cannot. So age is a risk factor, but so the older you we get, the the higher the likelihood that someone will develop a stroke. But that's not something we can really change. Things that we can change are other conditions that can predispose us to develop a stroke, such as high blood pressure. High blood pressure can injure the blood vessels slowly but steadily over time, and an injured blood vessel is more likely to lead to an ischemic stroke.
Okay.
Another condition is smoking. Smoking
Mm.
directly injures the blood vessels. So when if someone smokes, higher likelihood of damaging their blood vessels and causing a stroke. Things like high cholesterol or kidney disease, those have been linked with higher incidence of strokes. Having an abnormal heart rhythm. There's a very common condition called atrial fibrillation, which means that the heart beats irregularly,
Mm.
and that could be happening, and people may not know about it. Um, and as a result, when the heart beats irregularly, it can form blood clots can form in the heart, and then with the beating of the heart, those can get pushed out into the brain and lead to a stroke. Similarly, sometimes patients have narrowing of of one of the blood vessels in the neck that we call the carotid artery, and when that happens, sometimes that can cause blood clots to form, and then they can be easily broken off and travel uh, up into the brain. So those are just some of the major risk factors that we deal with. I think it's important to know what happens when a patient comes to the emergency room and there is concern for a stroke. And I'm going to share my screen and show you some of the CAT scans that we do.
Okay.
Can you see that okay?
Yeah. Yes. Here we go.
So when a patient comes to the emergency room and there is concern for a stroke, uh, almost like within minutes, the first thing that happens after the patient is deemed stable is a CAT scan with dye. So an IV is placed, and through the IV, a special dye is given, and the dye stays in the blood vessels, and the blood vessels light up. So this is a picture of a CAT scan, and the way we're looking at it is as if the patient is on the table and we're at the foot of the bed looking up. So this is actually the patient's left side, and you can see the eyes here and the nose and the ears, and this is the brain. The really bright area is the skull, and the bright sort of curvy lines here, these are blood vessels. And you
Okay.
can see a blood vessel here on the patient's right side, and you would expect the brain to be symmetric, but this is missing here. And this is an area of occlusion. Now, you may ask, what's going on here? Is there a blood vessel missing here? No, this is sometimes the way the cut is made on the CAT scan is it's not always it's not perpendicular directly perpendicular to the blood vessels, and that's why this is an artifact. But this is what we call a cutoff of a vessel.
Okay.
This is another CAT scan, a very similar study, but now this is on the patient's right side. Again, you can see a blood vessel where the contrast comes in and it just abruptly stops.
All right, cool. I mean, it seems to me that what we're looking at is, yes, it's tightening up, but it's also preventing blood flow. And then because of that blood, what exactly is happening to the brain when it's not getting the blood that it's supposed to be getting? I mean, is it just a matter of, like you're pushing it through a circulatory thing, and if it's not going through the way it's supposed to, then everything is, blocked up like a beaver dam or something like that? Or is it because you're not getting the fresh blood that you should get there with the fresh nutrients or whatever it is?
Yeah, so our body's made of cells and they need blood because that's the way they get oxygen and nutrients. Um, but it's mostly oxygen. So an area of the body that doesn't receive blood, that starts causing damage to the cells, and eventually the cells die. And once the cells die, the damage is irreversible. Now, it takes some time for that to happen. And what determines how long it takes is what part of the body you're looking at, uh, how healthy, like in the case of the brain, how healthy the brain is, which typically correlates with how young the patient is, and what other blood vessels can provide uh, blood to the involved area. So think of the blood vessels like branches on a tree, and if the occlusion is very distal, it will affect a very small branch, so not many leaves will fall off. But if the occlusion is like right off the tree trunk, then that's going to affect a very large area of the tree. And if it keeps going off, then a large area of the tree is going to die, and then you're going to lose a lot of leaves. So the whole the whole point here is that if you wait too long, and too long is a few hours, then that area of the brain that doesn't get enough blood is going to die, and the damage will be irreversible. But how long it takes for that to happen can vary. Now, when this was first looked at, they looked at a window of 4.5 hours. So if the patient managed to get to the emergency room within 4.5 hours, then they were considered candidates for a procedure that tries to get the vessel reopened. That has now you'll say, how did they pick 4.5 hours? I mean, they did a lot of studies on that, but now we don't have that strict 4.5 hour cutoff because we're able to do a study that I'm going to show you here. And this is really important because this is how you know whether an area of the brain is still salvageable or whether the stroke is completed and that area of the brain has died off.
Okay,
So,
related question from one of our listeners is here. My uncle recently, from Samantha, she says, my uncle recently had a stroke and has lost the use of his right side, can barely speak now. Will he walk and talk regularly again? And so I think it's very similar to what you're talking about. I mean, the idea is if he got there within those 4 hours, then he'd probably be better off than not. Yes.
yes, it depends on what the scan looks like. If he was able to get to the hospital and the hospital had the ability to do the procedure to reopen the blood vessel uh, w- within a reasonable amount of time, then he would be much better off. Now, if he had the stroke and even a few days later he still has weakness, he can still barely speak, chances are that he may improve a little bit over the next few weeks to months, uh, but he would never be able to go back to how he was before the stroke. Okay.
Yeah, you were showing us that document.
Yeah. All right. So there is a special CAT scan. Normally, with a CAT scan, everything is black and white. There's a special CAT scan that actually involves colors, and this is a CAT scan that we called a perfusion CAT scan. So this is a CAT scan that looks at the blood flow uh, to the brain, and each of these panels, each of these pictures, signify sort of a different property. So A is blood flow. So the computer software calculates the speed of the blood flow and assigns it a different color. So you can see here that the patient's left side, there is more blue than there is on the opposite side. So that's an area where there is less blood flow. Uh, Under B, this is something called a cerebral blood volume. And again, you see the area where there is less blood than the rest of the brain. And C is just a way that we can measure the speed of the blood flow. So they all kind of tell us something similar. But again, you can see an area of the brain that's compromised. This is a good way to tell how big of a stroke you're dealing with, and what's the extent of the area of the brain that's compromised. So we can use this CT perfusion information to tell us if the what area of the brain is involved, how large it is, and whether whether the damage has completely happened or not. Um, and the way we do that is, so these are, not to get too technical, but these are some scenarios where you can see here this CT perfusion. And what this tells you is, in this case, you have the CT angiogram that shows that there is a vessel that's blocked on the right side of the brain, and there is less blood flow to that part of the brain. But if the blood volume is normal, then that means that if you're able to reopen this blood vessel, you will save a lot of brain. As opposed to this scenario where this blood vessel is blocked, and on the blood flow you can see decreased blood flow to the left half of the brain, but there's the blood volume tells you that a lot of damage has already taken place, meaning that a significant part of the stroke has already completed itself. So again, this is one of the ways that we can use as physicians to determine whether someone who comes to the emergency room has an area of the brain that is permanently damaged and they didn't get to us quickly enough, or if they are lucky enough and they got to us quickly enough, and there is a large area of the brain that can be potentially damaged, but the damage is not completely irreversible yet. Does that
The
make sense?
human, yeah, yeah. The human brain is something else, man. You would think sometimes that you would not be able to recover from something like that. You're just showing me, and it's basically gone dark, right? That whole section where there's no
Yes.
longer any blood. Yeah.
Um, so the next step is, if the patient is a candidate for a procedure, then there is a procedure that we call a thrombectomy. And a thrombectomy means that to remove a thrombus, to remove a blood clot. And what we do in that procedure essentially involves inserting. Actually, let me show you this picture. Um, if this is the brain, and this is the blood vessel, and right here this is a zoomed in view, and you can see a blood clot that's completely blocks this blood vessel. Essentially, during this procedure, this is a minimally invasive procedure. uh, we go in through the groin, and in the area of the groin there's a big artery there called the femoral artery. So that we essentially place a large IV into the femoral artery, and then through that IV we insert long flexible tubes that they go from the groin all the way up to the neck and into the brain. And,
Sometimes I think you should never tell us exactly how these operations are done, because I'm thinking, wow, that's a really long wait. But for some reason, I mean, the technology must be amazing for you to get something that tiny to go so far and not like get stuck or break or not do what it's supposed to do.
and that was the limiting factor um, that prevented us from doing this like 15, 20 years ago. It was the technology and how good these catheters are. And a catheter is a fancy word for a long tube, but it's a long flexible tube that gets inserted in the body and can you can navigate it. So once you get to the clot, once you get to the clot, then you can just, I mean, it sounds silly, but it's like a rotor-rooter or a vacuum cleaner. You can essentially suck that clot and try to reopen the blood vessel. And you can see that here, this is a catheter. It's right next to the clot. And then this is to show you that there is suction to aspirate the clot. Sometimes
You
a
don't
clot,
know. Mhm.
I'm sorry.
You don't know how difficult it is for me to not make a blood clot joke. I'm in Jamaica, and this is just ridiculous. But okay, go ahead.
No, no, go ahead. You're muted yourself again.
No, you're not supposed to make that kind of joke. It's
All right.
supposed to be but yeah, a blood clot is clearly what needs to be taken out there. Some people would know what I'm talking about. you're,
Um,
you're, you're too
so
pure for this.
one way to remove it is by suction. The other way, sometimes blood clots can be very firm, so they're very difficult to remove just by purely by suction alone. So we use a device that kind of looks like this. So it's essentially uh, it looks like a stent. This device gets deployed within the clot, and essentially this device traps the clot in the in the weavings of the stent, and then once the clot is trapped there, and you also have suction here at the end of the stent, and then you remove that, and as you remove that, essentially you're gently scraping the walls of the blood vessel and removing the blockage and the blood clot with it. Now, what that actually looks like in real life is, obviously we don't have this view or this view, um, but we actually have this view. And this is a view from a procedure that's called an angiogram. And an angiogram is a procedure during which we get access to the blood vessels and we enter the blood vessels with our tubes and wires, and we can inject contrast within the blood vessels and take a lot of x-rays. So this is the an angiogram of a stroke. This is an injection into the left carotid artery, and you can see here that there is a branch point, and you can see the blood vessel here, but right here, this blood vessel ends very abruptly. So you can assume that there is a blood clot sort of more distal to that. And then after we're able to reopen the blood vessel, this is what it looks like. So if we hadn't done that, all these blood vessels would not get enough blood, and all this area of the brain, which is a very significant area of the brain, would
Would die.
eventually, yeah, would die off.
Where,
And
what section of the brain is that, and what does it do?
so that's this is the left middle cerebral artery. So if this was not done, then we would expect the patient to be unable to be completely paralyzed on the right side and to be completely unable to speak or understand speech. And the other problem that can happen is if you have such a large area of the brain that doesn't get enough blood, as the brain dies, it can swell. And if the brain swells and it's got nowhere to go, it can cause more injury. So a lot of times patients may need a procedure to remove part of the skull to accommodate for the swelling. So again, a lot of bad things can happen if this is left untreated, and
Okay.
that's why it's important to get to the hospital as soon as possible.
Okay. I see a few people watching. If anybody has any questions, you can add to the comments here, and I'll put those comments up, and we'll ask the doctor specifically if you have any questions about stroke or neurosurgery or in general. All right. Go ahead,
And
doc.
then just another common question is what does the clot look like? So this is another picture. This is on the right side now, and this is a really bad occlusion. This is a complete uh, internal carotid artery occlusion, where you can see that there is no blood flow to essentially half the brain. And then once the clot is evacuated, you can see how many blood vessels were saved, and this is actually the small fragments that you get out of the blood vessel. So they don't look like much, um, but even and you can see how small they are using the ruler. But again, these blood vessels, they
Those
can
are
be.
huge. Those are huge, doc. You're saying they're small. Those are huge. Can you imagine not being able to have blood go to wherever it needs to go? And that is the thing. They're huge. Those look like as big as what are those things you got to pass? Those stones you got to pass sometimes, and they ultrasound them so that they at a completely different part of your body. But
Kidney stones, yeah.
yeah, kidney stones. Don't they look as big as kidney stones to you?
I,
Those are
I,
huge.
I guess some of them, yeah.
They were big, man. Those are, can you imagine it stuck in your brain? Yeah, nothing's gonna work.
Now, the important thing to remember is that even after this procedure, you can still have a stroke, but the goal is to limit the extent of the stroke by trying to uh, restore blood flow to the brain, to the areas that have not died off yet.
I think this question is it's somewhere in that region. This guy's asking, David's asking, the doctor says he lost feeling in the hands. It might be signs of a stroke. What can I do to check? But also, what could he do to prevent himself from getting a stroke? Is there a possibility that you can, if you know that you're at risk for it, that you could do something to stop it? Or if you
Yeah,
have one, that you could reduce the risk
I
for
think
another one?
seeing your doctor is the first step. Um, the primary care doctors, um, they look very carefully for signs of high blood pressure, diabetes, um, kidney disease. Obviously, if someone smokes, they need to stop smoking, getting their cholesterol in check. All those things can help prevent a stroke. And diabetes is another major risk factor that I think we forgot to mention. Um, so if someone lost feeling in their hands, I guess it depends. If this is something that happened sort of immediately and very acutely, they probably should go to the emergency room and get it checked out. If it's something that happens slowly, gradually, it could also be a sign actually of pinched nerves in the neck. It could be a sign of stroke. I mean, they need to see their doctor, and they need to see a neurologist or a neurosurgeon and get the appropriate imaging. So you are muted again.
Trying to keep the noise down here. The Zarina Costello is actually asking exactly what you just answered. Is there any way to prevent ischemic stroke? So that's
Yeah,
basically
it's the way to prevent it is by trying to stay as healthy as you can. Um, Again, age is a risk factor, but we cannot change that. But uh, avoiding smoking, correcting high blood pressure, correcting high cholesterol, avoiding diabetes, avoiding kidney disease. Those are the making sure that there is no arrhythmia in the heart. Those are certainly things that we can do to prevent a stroke. Also, uh, if there are risk factors, then monitoring for any arrhythmias, cardiac arrhythmias, or narrowing of the blood vessels in the neck, which we call carotid stenosis, that's also very, very important because those are locations that could lead to a stroke. There's a little bit of an argument with aspirin. Typically anyone above the age of 50 was recommended to receive a baby aspirin, so the 81 milligram aspirin on a daily basis to help lower the chance of a heart attack or a stroke. And recently, there's been some argument whether it really helps you lower the incidence of stroke. Um, it's still not a bad idea to take an aspirin on a daily basis, unless there are contraindications when it comes to bleeding or ulcers.
so. What is it exactly that baby aspirin did or was believed to do that reduces the risk of stroke?
Well, it's a very weak blood thinner, so it thins the blood a little bit, and um, it can help the flow of blood, I guess, and that can
So we
help.
get rid of those. So we get rid of those clots that you were showing us in
Yeah,
the
it's don't think of it as a medicine that will dissolve clots, but it can enhance blood flow. But it also it's an anti-inflammatory. So the basis for a lot of these blood clots is inflammation. So and what that means is that a lot of times you can have an injury, and that's what inflammation is a response to injury. An injury to the blood vessel that is caused by hypertension or by cholesterol plaque or by diabetes. And that injury to the blood vessel causes inflammation, and which can then in turn cause blood clots, which can then break off and travel to the brain. So aspirin is an anti-inflammatory, so it has some benefit in that regard as well.
Okay, so maybe one of the ways it might be a little disputed, but
Yeah,
one of the
it's
ways,
it's it's
right?
multifactorial. Yeah.
Okay, okay, great. And that's recent, by the way. Like I heard that in like the last year that they started
Yes.
saying we have a study that says that it might be contradictory or whatever. All right, so very well. So where are we now? We've figured out what it is. We've shown how we can fix it. You've shown us scans, how you can actually see it happening. What else, Doc?
Um, so again, this is the key is for people to be aware that a stroke can happen. Um, it when it happens very quickly. There is most of the times there's very little warning, and as soon as it happens, the best thing they can do is get their relative, loved one to the hospital as soon as possible. And again, it's best to get someone to the hospital even if it turns out that it's not a stroke and it's something else, as opposed to risking taking them in when it's too late to do anything about it.
Right. All right, very well. Good, good. Well, I think that's a pretty well. We went over ischemic stroke this time. What's the other one? Maybe we can tackle that next show.
Yeah, the other one is the stroke that involves bleeding into the brain, and that's called
Okay.
a hemorrhagic stroke, and it's a completely different condition and entity, and the management is very different. So,
Okay, so guys, stay tuned. Next week, we'll probably be talking about another kind of stroke because this is Stroke Awareness Month in May. It's also Mental Health Awareness Month. And obviously, if you had a stroke, you may need to also have, be checking in on your mental health, right? Does it not only affect them physically, right, Doc? Your brain being affected by a stroke also means that now you may have lost a certain amount of activity in your brain and therefore some of the capacity to use it.
sure, that can happen. And also, having to deal with a chronic disability can also be very taxing and stressful. So, that can add a lot of psychological stress as well.
All right, I hear you. So, ladies and gentlemen, thank you so very much for checking into Brainstorm. This is episode 106, all about stroke, the silent killer. And we specifically went over ischemic stroke today. I want to say thank you again to my special always guest, Dr. Symeon Missios. I'm Ryan O'Neill Williams, coming to you live from Jamaica. He's coming to you from Long Island, West Islip. If you want to see a video of that little thing crawling through your brain and pulling out the clot, it's actually on his website. It's SymeonMissiosMD.com / I think it just says stroke / stroke. Even if that's not exactly where it is, go to the website, look around. You'll see all of the problems and all of the solutions that Doc has for them. I hope that you guys have a great evening and a great weekend. I'm Ryan O'Neill Williams again for Dr. Symeon Missios. This has been Brainstorm.
Thank you, Ryan. Enjoy.
Yeah. Thank you.